All right, guys, look, it's almost 2 o'clock. I can't imagine for you to be in here unless you really want to come away with something meaningful, right? And why else would you be here? So, it's a little dangerous for me because she said, don't be scared. I'm very scared. I don't even know if you want me to talk about oral surgery. I don't know. I'll talk about it a little. Who wants, not going to hurt my feelings because I got anything you want to talk about. Do you want oral surgery or you want more practice management? What do you want? Be honest. Okay. I'm going to give you a little both. Okay? I'm going to give you a little both. Now, I'd really love it. I guess you'll be. I don't give a crap if you guys leave in 5 minutes. But come on up here. Please. This is too hard. Come on up. Just come up a little bit. Make me feel like there's actually people here. I'm stuck up here with Roy and Garland. Come on, man. Come on up a little. You're here. You may as well get some stuff out of this. This is a good time. You can ask questions. Nobody's going to think stupid stuff. That's it. I'm loving it. I'm feeling it. You two in the back. I see you. I see you. I don't care if you leave in 10 minutes. Just get up here. We'll bond and break bread at the party tonight. I can't do that if I don't know who you are. That's right. Bring it. Now it's just like a big office staff meeting for me. A little smaller than my office, actually. Okay, so the first thing, that's it. I appreciate you. The first thing I'm going to say to you is no matter what I'm talking about in the next hour, and we don't even have to go the whole time, ask me anything you want that would make your office improve, that you could bring to your office that would make it better, because that's why you're here this weekend. Okay? Go ahead, Garland.
You've already told us that you didn't graduate top of your class.
Okay, I'll repeat that. Go ahead.
Okay. And there's only one number one in each class.
Yeah, well, I was even number 100.
What do you think undergirded your success? Because obviously you couldn't sell that you were number one. So what will you think undergirded your success of where you were from school to where you are now?
So in case you didn't hear him, he says, well, how do I account for my success if, I wasn't number one? God, it's obnoxious. I don't even have big feet. I just like to walk, and, that's what happens. Well, the truth's the truth. The truth is I went to Penn, which was a really good school. The truth is I was a psychology major in college. I was not a science major. I minored in the electives to get into medical dental school. The truth is, what do you call a doctor that flunks out of medical school? A dentist. I know it's funny, and I don't, I'm proud of being a dentist, man, and I'll take it. Because I think I'm probably maybe a better dentist. I did apply to one medical school. I didn't know what I wanted to do. But I was a pretty good student. I got into Penn, and I got my ass kicked. Everybody was a brainiac. I went to Rutgers undergrad. I thought it was a big deal. These guys were Harvard, Yale, MIT. They were really smart guys. So I didn't have the opportunity of the GPR. Everybody know what a GPR is, right? I didn't even have that choice. I literally did not have the choice to go there. My dad was a mom and pop dentist back in Bridgeton, New Jersey, southern New Jersey. I go back, the main employer of the town was a glass factory called Owens, Illinois. They closed up shop in 1980. That's the year I started. That was a nice town when I grew up, but it was failing. It was scary. My dad was like, I'm not kidding about that equipment. That's what it was like. The rope drills. And maybe because poor self-esteem, I don't know if you were here this morning when I talked about one of the unique factors and qualities of being as a dentist is unlike a physician. I have a friend that was a cardiologist physician, a buddy I grew up with, and he didn't like it. So he didn't take a continuum for 6 months. He went back to med school or whatever you go to for a couple years, and he became an oncologist. But you, as a dentist, you don't have to do that. You can take 2 to 3 years out in Arizona with Frank Spear and become this amazing aesthetic dentist. Right? I don't know if you were here again. I went to Frank Spear and John Coy's office 32 times. Excuse me, I did go to, you're right, 22 times. I was there when they were partners. I was there when they were not friendly. I took the whole thing. You know, I took so many implant courses. I still do, by the way. And so even the guy that's ranked 157, I mean, I had to be a little bit okay to get into dental school, I guess. Even that guy can learn. And that's the truth of the matter is, now in terms of how did I put that together with the leadership and business skills I have to keep people in my world for 18 years, which was very important to my success. Part of that, I guess, I just had. I wasn't lucky enough. You know, I didn't learn that. I never took one practice management course in my life, except the year before I became a speaker, to see what others they sounded like, because I didn't know how to learn to speak. You know, so I went out there for taking the guy from Arizona, Blatchford. Is that his name? Bill Blatchford, whatever. I remember pissing him off too, because I didn't mean to, but you know, he went around the room and asked why we were here. I said, because I plan on being a speaker next year. I want to see how you guys sound. I'm a pretty honest guy. And if you really want a straight up answer, and I ain't playing with this, I do think I'm a soldier of life. I mean, I've done motivational speaking way far outside of dentistry for pharmacy companies, and almost every motivational speaker in the world, I'm sure I've never heard you, Roy, but I get a sense, has overcome something really ugly, right? That's the things that they've overcome to become successful. So I never was in that place, and I'm talking right now to the whole team, because I think it's worthy, whether you're the dental assistant or the doctor, that nobody's coming to rescue you. You know, this is your life, and you're in control of its life. So I found myself 20-some years old, not a particularly esteemed dentist. I felt really I had stayed back in school, to be honest with you. It'd be one thing if I was from Beverly Hills or New York City, and I was going back to my very successful father's practice, and, you know, that maybe would have given me a different vibe, but I felt I had stayed back in school. I felt I was, you know, I didn't even barely know my father. I grew up with my mother. So now I'm working with this guy I barely know that happens to be my dad. And, you know, he was a good, solid guy and a good, solid dentist, but it was clearly a mom and pop practice. I don't know if there was, in 1980, if there was really progressive practices, but I was incredibly depressed with my life. I was in my hometown. My friends weren't there. They had moved. And so the first thing I decided I needed to do, or wanted to do, was become a better dentist, because apparently I wasn't that great, according to grades anyway, you know. And look, I recognize that you can be not that great with biology and physiology and be very good the last 2 years of dental school with your hands and with people, and I always was pretty good with those type of skills. So I just, you know, I'm the guy, you can stomp on me, you can cut my arm off, and I'm going to get up again. So the answer to your question is I think what accounts for the great success I've had is I also look, and to be quite frank with you, I don't think I look at it enough like I would tell your audience. Like, I think you need to really look at the big picture of what you can or want to do in life, okay? So, for example, here's a good example. I taught strictly management for the 15 of the 21 years I spoke, right? All I would talk about is how to make your business better. But in every lecture I ever taught, I always heard myself say, clinical excellence will take you further than any practice management gem I could give you. You know, and I really believe that's true. I don't believe you can be incredibly Dale Carnegie-like and with these amazing people skills and be a crappy dentist. I think that'll catch up with you. And I didn't know whether people knew I was, because I thought I was really good after 10 or 15 years of training. I really thought I was really good, and I do think I am. And so I wanted to audit, so I changed my whole lecture to science stuff. I do both now. I mean, I'm hired by BioHorizons to teach implants, and I'm licensed by the state of New Jersey, as I indicated in this lecture, to bring people into my office. And I never dreamed I would be good enough to do that. But that's what I mean by looking at the bigger picture. Now I can do both, So, look, nobody's, like I said, nobody's going to come and fix your life for you. You know that. I mean, you're obviously successful. You obviously know that not every accounting firm or management firm in America puts these kind of things on. They don't. Some of them do, and maybe they get 12 people, and that's where they stop. They never grow to 100, 200 people that you have today. So with all of us, it's just, how bad do you want the success that makes you truly happy? And as I get older in life, like I am now, I really, and I speak to all of you when I say this, the different things make you happier as you get older in life. Like that stuff I said in the very beginning, that's why it's in the beginning of my lecture. I mean, I guess I could rephrase it a different way, but the way I phrased it was, what's in it for the doctor? Remember I said that? And then what's in it for the staff? That's how I started. I could have said, well, what is true success if I wanted to? And to me, true success is not whether you got a $4 or $5 million practice, because you could have that practice and still struggle with payroll. You could. And you could have that practice and not be able to take a week or two off, like you want to, and really with freedom of mind. To me, true success is one sentence to me, and that is being able to work when you want to work and being able to take off because you can take off. And there's not too many people that can really do that. And that's why you see me dive right into the second part of don't debt yourself to death, because that's such a pattern in dentistry. Guys, you probably know that better than I do. And I get it. I know why we do it, because it's there for the taking. Banks will give you whatever you want for the first time in your life, and it's very easy to find yourself 4 years into practice and owning a couple $100,000 more than needed to be home, and something else. And I think that can lead to bad things. I don't know where that came from, but anybody else? I think I should pay you for
I feel like you're about to lay on the couch.
That's what I'm saying. All right, so I'm not even sure where I'm going with this, but let's just see where it goes. Okay. You may see me really skip ahead. You said some people wanted both, so I'm going to try to give you the guts of both. I'm looking for my advancer. Here we go. So last time I'll self-promote, but it is a great course. So if you don't know how to do it, and the reason I'm talking about extractions is because I truly, truly believe in, how many here, this right here, were in the implant course? Oh, hardly anybody. Oh, you guys, I don't know, I can't, a little higher. Oh, a lot of you, okay. So, if you're going to, that in that course on purpose, I talked about oral sedation. The reason I talk about that is it's by far, there's no doubt about it. That's the thing you need to learn if you want to have the greatest impact to your practice, and it is the easiest thing to, how many were not in that course? Okay, and that said, it's the easiest thing to learn. There's no skill set to learn oral sedation the way I teach it. The skill is in the pills. It's not because I do something tricky when I hand them to you. It's there. The first time you do it, you're as good as me. But then what happens if you're going to do oral sedation is you're going to attract patients that need teeth removed. So the vibe does not work. The karma doesn't work for you to attract patients that believe and trust in you. And believe me, I don't care whether it's oral sedation and treating people who have fears, or you're treating 6-month ortho or endo or whatever it is. People are accepting you based on their confidence and belief in you at that moment, at that pivotal moment when they're in that chair. And you are going to be so powerful when it comes to oral sedation, because you're going to, after the very first case you do, I'm telling you, the patient's going to thank you, and so that's the first time it was ever pleasant, and all that kind of stuff. And I don't think it's that way with when you just give straight triazolam or you give 20 milligrams of Valium. I don't know why the concoction I gave you of triazolam, Atarax, and Benadryl works so well. I'm not a pharmacist, but they do. And it's safe. Yeah, Doc?
Well, I was just going to ask you, how do you find the Atarax, Benadryl, triazolam compared to just giving
I've tried everything.
milligram of straight triazolam?
I have certainly, I know there's a lecture in town this weekend of oral surgeons thanking her. I do lots of those lectures where I'm the guy that they hire to say thank you to the referrals. I've talked oral surgeons out of advertising IV sedation and use the concoction I use. Because if you really think about it, we make a general statement, a lot of patients will do IV sedation, but if you give them the choice and say, hey, this is just as good. Now, it may not be just as good, well, I think it is. I was going to say, it may not be good as for 4 wisdom teeth, because I don't really do wisdom teeth, because I don't think it's cost effective, even though I obviously know how to do them. Were you here when I said don't do wisdom teeth? Yeah, don't do wisdom. No, don't do wisdom teeth. There's no reason to do wisdom teeth, unless they change the fee schedule, and they make it $5,000 a tooth. Yeah, I guess maybe that's worth it. But it's not that. And so the only reason people do wisdom teeth is because it makes them feel more like a man. I don't know. I do wisdom teeth. Who gives a shit, You probably have more paresthesias than I ever will dream of, and, forget it. There's just too much dangerous stuff back in the third molar, so don't do that.
Do you require, a conscious sedation license in New Jersey?
Yeah, I don't know if you were here when I said it, but yes, you can't just give these pills. What I would do, I swear to God, this is what I would do. What state you live here?
I'm in Ohio.
Yeah.
We're allowed to give triazolam.
Most Most states will let you give one of they won't let you combine. I don't know about Ohio, but that's a general rule. So you can give triazolam, yep. You're not going to get the same effect. I'm telling you, you're not. With triazolam, without Benadryl, without Atarax, without nitrous oxide. I don't know if you can classify the state of sedation that they're in, but it's probably a little closer to a higher level than it's supposed to be. Okay, now that being said, I've never had one incident ever. I've done this multiple times a day for 21 years. And I need to impact to you, I don't know if you're a visualizer like I am, but I want you to visualize what that is like walking into your practice a year from now, and every single day, you got rooms. How many rooms you got in your office? 5? 4. Okay. 1 or 2 of them are dark, and you know that there's somebody sedated in that room, and you are totally relaxed. I love it. It's a lovely, lovely way to practice dentistry. It really, really is. It's different. It's hard enough what we do, so I like making it as easy as I can. Turning the lights out, I don't know why, it just chills me out a little more. And having the patient snoring, and hearing the beep, 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 beep on the pulse ox. I don't know, man, it's just like music to my ears. And when I've done it thousands of times, and I hate when people exaggerate, so I'm not exaggerating, thousands of times without incident, damn right it's relaxing. And you know what? Once in a blue moon, I'll get somebody that will talk me out of, I didn't even get to what do I charge them? You should have asked me that. What do I charge them? I'd pay them to do it, let alone charge them. Are you kidding me? I don't charge them. And I'm not saying whether that's smart or not. I use it as a practice management, seal the deal kind of thing. That's how I do it. Because listen, I want you to picture this. I am going to include in this section, because you're here, and I think it's worthy and worth it to you. I'm going to do a section called The Art of the Close, how I get people to say yes. I'm not just talking about sedation. I'm talking about everything. Because at the end of the day, that's what determines how you spend your days, right? Somebody came up to me at the break and said they took their people from 35 to 85% case acceptance. Well, that's a big deal, man. I don't know what my percentage is, but it's very, very high. And so how does that happen? When we sell stuff that's elective, which is what we do, how do you get people in my neck of the world, that's southern New Jersey, poverty area of the country, how do you get people to consistently, think about it, reach into their pocket for the first time in their lives, and none of them look like you. I mean, they look poor. I'm not saying 100% of them, but a lot of them look like they're indigent. And I get turned down a lot, by the way, from Care Credit, and it's not easy what I do. You know, I got, is Care Credit in the room? Where? No? Are you or not here? Care Credit here?
Yeah, they were back there.
Are you in this room right here?
They're not inside here.
Okay, so you need a second company too. Well, I'm here for you. You need Lending Club too. I'm going to tell you why. I love Care Credit. Care Credit I owe a lot to. They've supported me. They're good to me. But the truth's the truth. They use two different credit sources. And so you will get 0 sometimes from Care Credit. And you'll get $20,000 from Lending Club. And I'm here for you. That's the truth. Why I'm not going to keep that from you. And I think Care Credit is a big enough player in the industry that they would be okay with me saying that anyway. And sometimes Lending Club will turn you down and Care Credit. Because they go, I'm not a financial expert, but they go by your credit scores of, 800. Do you know what 800 actually means? It's 800 parameters that affect your score. And they don't use the same parameters, which is good for you. It's good for you. If you're bankrupt, you're probably not going to get it from either one of them. But I'm telling you, I get turned down a lot. And so, how is it, that's why I'm sharing that with you this afternoon, how do I get people to say yes? But I can tell you something. When that patient's coming to me, and the reason they came to me, and it's the number one reason people come to me, is because I have done the sedation thing for so many years in a part of New Jersey that it's very easy for me to establish that reputation. But I'm telling you, whether you're in Ohio or whether you're in Nashville, Tennessee, or wherever, Texas, or wherever you're from, it works. And for some reason, most of your colleagues will not do it. It doesn't matter whether I lecture to them and tell them how easy it is. I don't know if they're scared, they think they're going to kill somebody. For real. Or maybe they just don't want to learn the other skills that you need to learn if you're going to do oral sedation, which is extractions. And the only reason I want you to learn implants is because it's so lucrative and so predictable under some conditions that if you know how to take teeth out, it's just silly for you not to know how to place an implant. I swear to God, if I spoke to brand new graduates of any dental school in America, and they said, what's the quickest road to success for me? It doesn't sound sexy, but I would say I wouldn't tell them to go learn occlusion from Pete Dawson like I did, or at Pankey like I did. And they're good things. They are good things. They're just not the quickest road to success. Even going to Spear is not the quickest road, because that doesn't blow up your phone. But when you advertise that you are the man or woman in your community to help people that are fear, and it's so easy to create really cool ads about that, which I have in my book, The Extraordinary Bulletproof Book. Look, if you don't buy it, I don't care. Just look in the back and you see the 20 ads I have. It's so easy to write ads like that, and they're so much more compelling than anything else I can come up with. They just are. What can you come up with? I got a master's in the Academy of College. Who gives a shit? Sorry. Because nobody knows about what that means. But everybody knows what it means. And you know what the thing is, and I know I'm being repetitious, it really does work. You're not going to hurt people. And they're not going to remember much of what you do anyway, and they're going to tell people. Yeah. Yep, the big three. Okay, so let me go over it one more time. So here are the basics. Number one, I keep them pre-packaged in my office. So why do I do that? And I don't charge them either. And I don't know if that's a mistake. You may hear me in 3 years and say I changed my mind. I've done this for 20 years. I've never charged them for it. I looked it up. The pills cost me, just 3 pills, it cost me $8. I know that obviously the nitrous cost me. I don't know what it is. And so to me, it's almost like, ever close a deal and have somebody pay you $5,000 or $10,000, $15,000, but you're still not really sure that you got the deal because they're not scheduled for 3 weeks, and so so remember, like when you go, maybe this is not a good analogy, but you go and you try shoes on in a shoe place, and, after you try your third pair on, you better buy something. That's how I'm feeling. So the more I set them up to not want to get out of this, and part of that is them trusting me that I'm giving them, okay, so here's what's going to happen today. I mean, that's how I talk, and you'll get line by line in a few minutes. When you go up to the front desk, we're going to give you a packet of pills to take. There'll be 3 pills in it. Put it somewhere safe if you have kids. You're to take it the morning of, 90 minutes before you get to my office. You need a ride. They sign off on a thing that they will not drive, and, I'm telling you, I never had an incident, not once. I have heard of incidents of people sedated that ran and, did bad things, but I've never had one. And when you get to my office, I'm not sure the state of your condition, but most people like it. You might even be sleeping by the time you get here. And I'm going to put you up on nitrous oxide. Now, once in a while, by the way, somebody will say, I don't want that. It makes me hallucinate. My brother got addicted to it. It's ridiculous. But, you'll hear crazy stuff. But the nitrous really makes a big difference. And here's what I always say, Huey. The drugs put you here. The nitrous lets me take you wherever I want. So if you're like whacked on the pills, you're just going to get 100% oxygen, excuse me. If you're like, I don't feel it, I'm going to give you 50, 60% nitrous. I'm telling you, I was honest with you this morning, I'll tell you again. Most people that tell you I don't feel anything, it's more than that to them. I can't define it after 21 years. It's almost like they don't want you to succeed. Not all of them, but some of them. Or they're in spite of themselves. It's not even that. It's just they're so used to failure. It's like somebody else has tried on them. Somebody else has tried 20 milligrams of Valium or something else, and it didn't work. And so I don't wait a long time. If they're not sleeping in 10, 12 minutes, and by the way, they are responsive even though they're sleeping most of the time. If you spoke into their ear, when that blood pressure cuff goes up, 90% of the time means they have to go to the bathroom when the pressure goes up. So let's say the pressure starts going up. You whisper in their ear, you have to go to the bathroom. Almost all of them will respond after you do that a couple times. Now look, you're going to get all kinds of ranges. You get people that really are so loud when they're snoring. It's obvious they are out of it. And that person does take longer too. That person that's snoring so loud, I have videos if you YouTube it, of people sedated. I would probably put them on 100% oxygen. I would. I'm telling you, man, it is so predictable. And I am talking about gaggers. I'm talking about the whole realm except children, which I told you I don't recommend you ever sedate. And a child to me is, 16 or under. I don't think I've ever sedated anybody under 16. Yeah, Doc?
So, are there any known medical contraindications to, not even that concoction, but I'm sure I can look up a lot, but some of those drugs? And I know you have never had experience that negative. But are there any diseases, any other medicines that make you react?
Well, because of that reason, that is why I tell you also. I've never had I did have one incident, but it's not an incident. The guy couldn't get out of his car, and he was drunk on top of my drugs. He was a minister, by the way. And the only reason I knew it is because I needed help getting him out of the car. So I literally, I'm a everyday dentist like you. I went to his car to lift him from my girls into the wheelchair, and whoa. And he was so out of it, I called 911. Nothing happened. Nothing happened to them. You got to understand, a lot of people, okay, you want another one? This will make you comfortable. I've never told anybody this. Okay, this is it. So, about a year ago, I had a patient come in, and I don't know if you were here in the morning session when I was talking about how impactful implants can be. When you extract a tooth and it's a 5-wall socket and you got all the bone there, there's nothing easier to do. There's a couple principles you need to know that are different than when I started implants 20 years ago. You don't fill up a socket with an implant. That is what they taught us 20 years ago. You try to leave 1 millimeter to 2 millimeters of buccal space, and that's so you don't get shrinkage of the gum. There's some really easy. So all that means is when you're looking through your loops into the socket, you begin your osteotomy by going a little bit palatal. That's all that means. It's not hard stuff to do. But anyway, so I can do an implant right on the spot. I mean, it's quicker than me than a root canal. Pull the tooth, do an implant, quicker than a root canal to me. Well, this came in unexpectedly. It wasn't on the schedule. And my pharmacological protocol for implants is a medral dose pack, which is 5 prednisone to start, right? My front desk person actually gave him 5 triazolams. I've never used more than 2. True story. So I walk in the room, it's like 4:30 to, if the patient's numb, I'm going to take number 14 out and do an implant. And the patient, in 15 minutes, was like, he looked dead. And I knew this patient. He'd been coming to me for 25 years. So I knew his character and his demeanor. So I didn't know that's what happened, because she denied it, by the way. Because I didn't know for sure. I said, "What? What's with this guy?" I talked to my assistant. And we tried to get it out of him. We're like, what color were the pills? Because the triazolam are blue. And medral and prednisone's white. I think they were blue, and I'm freaking out. I don't know. I never gave anybody 5. I thought I'm killing the guy, right? I'm not a pharmacy guy. So I start injecting him with the reversal agent. And all it does is make him throw up, right? Long story short is to be safe, I called 911. And I'm telling you this long story because the physician told me, who's my patient, I didn't even get sued, by the way. I should have, but I didn't. The physician told me, this happens all the time recreationally. They don't die from it. They just sleep it off. They don't die from it. They just sleep it off. I don't know how many you have to take to die. But 5 doesn't kill you. Expert Dr. Rasner. Raz says 5 don't kill you. So, yes.
But you do get the clearance from your physician,
Yeah.
and so they come in for a new patient consult, and they're going to get the work done. They give you all their information, and they know they're coming in with somebody, haven't taken the medicine
Yep.
before 90 minutes before their appointment, and so they're in the waiting
Yep.
room, and we're going to pull them back 30 minutes before we're supposed to get started. Or what?
No. I mean, and by the way, I'm glad you said that. Everybody here, like, she's trying to get the picture in her head what it's like. And I have some couches in my waiting room. I mean, they're slaying on them with their feet like on the pillows. I mean, they make you very uninhibited. I mean, they don't give a damn. They're just like, they're happy, and they're just wasted. Not all of them. Some of them. Some of them are just, And usually when you respond to them, hey, come on, ready for a appointment. No, we get them like I get a normal patient. And I'd say 1 out of 10, maybe once a week, maybe. We put them in a wheelchair and wheel them back and turn the lights out, put them on nitrous. And I wait, they get numbed. It is so predictable, man. It is so routine. I can't even begin to tell you how it's, when you've done, if I say 1,000, it's got to be thousands of cases and nothing happens, you're very relaxed. You're very, very relaxed in this approach. And so, I forget what I was saying, but no. So how do you get them out of it? I can't even explain this either. I turn on the lights, I sit them up. Now you got to have an extra room because you can't rush people in this stuff. And we start talking to them just like when you guys go in the recovery room and you wake up, I don't know. They're a little drowsy. Most of them have been there a couple hours. Most of them, I can't think of too many cases that it's 1 hour and I do that. But I do have patients. Now I want you to think of this. Think of the power of the patients. I mean, how many of your patients really like scaling and root planing? I mean, I don't even like that. Not that I've ever had it done, but it doesn't look pleasant. And so, that's how we're doing this. They may go to hygiene for an hour and a half, get scaled and root planed on the left side. Then they get up, go to the bathroom. They don't remember going to the bathroom. I've never had a patient in 21 years of doing this fall down in the bathroom. How about that? Am I just a lucky guy? I ain't no lucky guy, trust me. If you knew my life, you would not think I'm lucky. But I never had a patient fall down in the bathroom and whatever, except the guy that took five. I'm telling you, it was like out of a movie. He had to go to the bathroom, right? Now, I'm still not positive because nobody's admitting that they gave him that. But why is he acting like this? And I've never seen it. So I walk him to the bathroom, stand him up. His name's Paul. I said, Paul, you think you're okay? Like, I have a handicapped bathroom, and he's holding the rail. I think you're okay, right? And I'm scared. Like, I don't know where this is going. I hadn't called 911 yet. And I walk out of the bathroom, and the friggin' door closes and locks. Like, why? It never did that once ever in my life. It locked. And I'm like, imagine. I'm like, Paul, you okay in there? We break the door open, and he's not answering. And he's on his knees, and his tie is in the toilet. Oh, yeah, it was horrible. It was, I don't know. It's enough information. Okay. Where were we? Yes.
So when is the crushed under
The crushed is
the, when it's
was that the original question? Okay. Yeah.
That's okay.
Okay. You crush it and put it under the tongue. On the patient, it says, I don't feel it.
Okay.
10 minutes after you try to up the nitrous, and
Okay.
that almost never works when you up the nitrous. But it does once in a while. It does. So it's worth the extra 10 minutes. I'm telling you, to me, the sedated patient room is a room that I'll get to whenever I get to it. Because, by the way, you didn't ask me, they're good for about 4 hours. 4 hours. It's amazing. I've had patients in my office this week, not 5 years ago, this week, 6 hours. Sometimes we'll give them a second pill after 3.5 hours. Yep. Doing lots of stuff. A lot of stuff. And people like that. They like getting a lot of work done, yes.
So if you're not doing a lot of work, what is your protocol for patients who want to be sedated?
Same protocol.
Put them in the end of the day?
No, because I'll do them the same way. I'll just say, look, you're going to be really out of it when you leave.
But you got to go.
Oh, yeah, they're not tying up my room for 4 hours. They're not tying up my room. Yeah. I'll let them out of the room for a while, half an hour, whatever it is. I don't know. I've never run into the situation where I had to eschew somebody out of the office early and then they tripped and fell or something. That just never has happened. Never, not one time. Think about that. Thousands of patients, never one time. You think I've had patients fall that weren't sedated. I'm telling you something, if this interests you a little bit, you owe it to try it to yourself. Because it's a game changer, man. On every level, getting paid up front, marketing to that patient, the word of mouth because you're successful on that type of patient. And what do you think? They got needs. They always have needs because they haven't been to a dentist, a lot of them, in years and years. So, yep. I didn't hear you. Yeah, we bulk order them. Yeah, that's what I do. No, look, every situation's different. I've been in the same town 36 years. I don't know if you can do it in every pharmacy in America. We order, 90 pills at a time. And I don't know if I guess it's legal. I don't know. 1 second, somebody asked me. What? Yeah.
Oh, yeah, how about weight?
Yeah, it doesn't really have anything to do with weight. No, obesity does not. It's not that. No. I can tell you, it's more of what their past is. They're thin partier. A lot of people come in with chronic back pain. I would say, I don't have a percentage on the 3 pills works 80% of the time, and I mean 80. Okay. And don't get freaked out if you give the second pill, because it's just a little harder to wake them up. Maybe in my career of 20 years, I've given a third pill 3 times. And I don't know if it's never not worked. I can't remember if it hasn't. Yeah.
Do you have a protocol in your office for protecting your massive stockpile of Trizolam?
I don't. Safe. I have a safe. I don't know. I don't think it's a cool drug to. I think it puts you to sleep. I don't know.
Are there any ramifications to your malpractice insurance?
Nope.
premium?
Nope. Nothing. Nothing. No change. My insurance is. I'm surprised that my malpractice is even different because I do so much surgery.
Sometimes they ask
Yeah.
that you perform conscious sedation on the
Yeah, it's not that different if it is at all. Remember, I want you to remember something. I did IV sedation for 15 years, and I'm telling you, this is better. It is. All right. You good?
One more question. So when you have to reverse that person,
Yeah.
using your reversal agent,
Yes. You shoot it right in the buccal vestibule.
you shoot in the buccal vestibule.
Yeah, just as if you. Nope.
Okay. And what's the reversal agent?
I forget the name. You got to write to me. I don't remember. I've only used it once. That guy. It might be Narcan. It's got a bigger name than that. You know, it's probably a Narcan derivative. I don't know. I don't know what it's called. Can't remember right now. But you just shoot it right in the buccal vestibule. Okay. So there's the next time I'm giving a course. If you want to see, it's February 3rd and 4th. Remember, I'm going to just throw you to the wolves. I'm going to teach you briefly in spurts, throw you, ask you how you did, what was tough for you. I'll know because I'm watching you anyway. And continue. So why am I teaching this? Well, already know why. Some of this is not appropriate because we've been through it already. I told you these don't do it. So here was I gave this at some universities. What I'm saying here is, what if you can manage, and I can't even see back here right now, this gingival recession, what if you didn't have to send that out? Because the oral surgery course, I'm going to, like any other course you teach, kind of depends on the crowd. So if the crowd wanted to learn in my office connective tissue grafts, then I would certainly teach that. Or level these margins. Or do a semi-lunar coronally positioned flap. That's the first periodontal augmentation procedure most people learn. It's really apically, incisally displaced flap is what it is. Or you'd have to refer that. You knew how to treat those. These are really good clinical results. It's a shame the camera's not showing it. You didn't have to mutilate 8 and 10, put number 9 there, which is an implant. You can manage that gigantic buccal defect like that. And you could do that while they're asleep. I started to tell you, I don't know if I finished my sentence. Once in a while, somebody talks me out of it. They say, oh, I don't need that. And I am so sensitive now because to people that are great because they're sedated, that I've realized that I got no patience for the others. It has been so long since I've, ooh, ow, ooh, ooh, ooh. Yeah, I mean, I'm getting older. Maybe I'm cranky. I don't know. I don't got it in me anymore. I want you to be sedated. So I'm going to obviously be talking about this, so I'm blown by it. I don't know if you were here when I said it gives you newfound time because you do not have to, look, when you've been practicing 10 years, and if you know how to take teeth out, it doesn't take you long to do that stuff. It doesn't. So, I have time to go into hygiene, and it has made a big difference in the beginning, I might not have realized all what I'm telling you right now, but I'm telling you now, it gives me time to be a real person in hygiene, and because it doesn't take me long at all because I'm not dealing with a difficult patient. It's almost like working on a dummy. Remember, if you just tell me to send you everything, you're going to get all this. This is what it sounds like. You got sound back there?
With another in a series of oral sedation patients, for those of you that are interested, we're not allowed to call this sleep dentistry, but what would you call it? As you hear my patient, I believe, snoring. And today,
I mean, you know how cool that is? I mean, they're snoring, man. I mean, they're out there. Now, careful what you say, because a lot of them say they can hear what you say. And you shouldn't say some stupid shit anyway. Pardon my language. You know, you shouldn't be in there saying bad stuff. And be a professional, for God's sakes. But don't think they can't hear you, because you never know when they can. And, okay, forget kids. Okay, let me get through all this. You guys know about articaine, septicane, Zorocaine, the power of that, correct? I mean, I didn't know about it 10 years ago, but it's a great thing to have. That's just showing you how to give an injection painlessly. Here's a great marketing idea. This is probably not earth-shattering to a sophisticated crowd like this. Solutions Reach. It's pretty cool. They don't pay me to say this. I pay them just like you pay them. But this is pretty cool.
Surprise! Happy birthday from Storage Dental!
We send that out, or they send it out to people. That's obviously generic. It was kind of fun making our own in the office when we did it. It takes like 10 minutes. So this is how I came to this actual course to teach implants. I didn't finish something this morning for those of you that were here, and I just want to make a couple points clear. I don't know where to tell you to go anymore. Mike Picos is the gold standard. I mean, Carl Misch for sure was the gold standard. But those of you that are involved in higher education know that he is sick. And I just don't know how long, so that's the truth. You'd have to ask. But, you know, he has a 5-session continuum that I took more than once. He's the smartest man I've ever met when it comes to science. And even if you just bought his books, it's just amazing. But you heard me tell you the protocol of don't listen to anyone. Because let me explain why I say that to you. So I took Carl and fell in love with the guy and his philosophy. This is back in the 90s. And Carl was a gigantic proponent of sterilization like you're doing open heart surgery. Well, that's all I knew, so I listened. And I'm back to my office, and that's what my office looked like. That's not me, but that's what my office looked like when we would do an implant. And I'm telling you, I would freak out when I broke sterility, which was every 2 seconds. You know, I'd scratch my head, or I don't know what I did, but, you know, and oh my God, I got to go re-scrub. And this went on for 3 years. And God knows what I spent on all that stuff right there, and the agita that it caused me. So then I start taking other courses, and I take one, you know, sorry. I just can't sit still. I take one from a well-known speaker up in implant guy in Connecticut. So that was my first guy other than Carl. And I get to this guy's office, and this is a periodontist, well-known. And I'm not saying he's wrong. I'm just saying this is why you don't listen to one guy. And I get there, and he doesn't even use sterile gloves. Doesn't have sterile nothing. It's like he's getting a haircut, right? He's teaching me Ramus grafts, right? No sterile, no gloves, nothing. He drops the Ramus graft on the floor. 3-second rule. He used it. I mean, maybe he can. I don't know. I'm just saying that's how different. So after that, I went back to my office, and I haven't done this in 15 years. And there's not one bit of difference, by the way. What do I do? And there was a study by Dennis Tarnow, and the success rates, whether you do what I just showed you or whether you don't use anything, is less than 0.5%. That's pretty small. So what do? I put on sterile gloves when I start the osteotomy, and I open up the drill kit. That's it. You know, I scrub. I do. I scrub. I wear the gown. But if I break sterility, which I obviously do, I don't start over. And I've noticed no difference. If I'm doing a sinus lift, it's a little different. But here's another thing. Carl, that's why I'm telling you this. I want you to do implants. But everything you get from everybody, including me today, is going to help you. Well, Carl is a tremendous proponent of screw retained. Unless he's changed, I don't think he has. I heard him this summer. He's anti screw retained. Well, that's stupid. Because when you do implant dentistry, this is what happens. You're going to get loose screws, and it's going to destroy your profitability. So I would always tell you that when you can go screw retained, which sometimes you can't, especially in the anteriors, go screw retained. Because if you chip porcelain, which you were going to do, if you get a loose implant crown, not the implant, the crown, happens a lot. On a Bruxer, it happens, trust me. And it destroys your profitability because that patient just paid you some big time money in the last 5 years for this, and they're not going to put up with you putting composite in there. So that's why you don't listen to any one person. Those two caveats I just gave you. You don't have to be sterile, and you should go screw retain whenever you can if it doesn't violate your aesthetics. Will save you at least $20,000 that I spent, that you're ahead of me already. Damn right I'll go screw retained. Okay. And when you do, the biggest thing about implants is to prepare. What's that saying? If I had 8 hours to cut a tree down, I would spend 7 hours sharpening my saw. Ever hear that? That's a classic preparation quote. That's what implants is about. When you prepare pre-surgically, you follow guidelines, you get results like that. I mean, that's number 9. Pretty sweet. 8 and 9, implants. Atraumatic extractions, that's what we're supposed to be talking about, but I'm going to not spend much time on it. A few years ago, this is what you had. I mean, 5 years ago, that was my armamentarium, and I was pretty good then. Taking teeth out is not about the forceps. Keep that in mind. It's got nothing to do with the forceps. It's all about leverage with elevators. It's the opposite of what you would think. So that's the name of those elevators. That's a periotome. That's basically an elevator. You put the flat edge of the elevator up against the root, and when you turn it, the root moves. That's the skinny on taking teeth out. Obviously, there's way more to it than that. And these are the forceps I thought were a big deal. This is all 5 years ago. And I would actually teach this. That's how I would teach taking teeth out. And it works. But guess what? Everything changed in the last 5 to 7 years to make it unbelievably easier. It's all about creating fulcrums with new age elevators. So let me tell you the thing, and I'm not pretending I can teach you to take teeth out in this environment. What I'm trying to do is etch in your brain how easy it is and why it's easy. And here's why. Taking teeth out today is all about creating fulcrums and trothing so you can stick instruments in that didn't exist 5 years ago and turn those instruments and teeth get loose really quick. Do you follow me? How many dentists in this room right now? Okay? So taking teeth out 5, 7 years ago was really a lot harder. And I know what would happen to lots of you. You put a forceps on, you learned what I learned. Lean to the left, lean to the right. You know what you were doing? You were expanding the bone. That's what you were doing, which is the right thing to do. And then you lean too much, and it breaks off. And then it creates the proverbial nightmare of where to go. So I eliminate all that for you in my techniques. So you go up, you see the lines up here, or where you've trothed, and I'll go back to that. And a trough just means you're creating a space to put an instrument in. Envision the roots. Teeth aren't parallel, they're conical. So you got to remember that. The little things can screw you up. You go straight down on the distal of number 8, and you might hit the root of number meso of 7. So you got to remember everything's conical. You need certain burrs. I didn't know this burr existed until 6 years ago. I took a 5-day course with Dennis Tarnow in San Francisco. And that's the beauty of networking. That's the beauty of doing what we're doing right now. That burr is at 859.36.010. Get it. Now, you get a bunch of them because they burn up really quickly. And you use these, it's a diamond. I'll show you it in a second. Use it in the aesthetic zone because you don't have a lot of room in the aesthetic zone. You know, there's other burrs to use in the back of the mouth. It looks like this. You see, I'm showing you how they get bald really quick. So that's what happens. And I don't know how much they cost, but you absolutely have to have this drill if you're going to take teeth out in the aesthetic zone. Okay, so what is my process? This is in your handout, or I'll send it to you. I don't want you to write really fast and feel you have to do that, or take pictures. This is the one I just told you about. This one is just a rounded Fisher burr that I use for non-aesthetic areas, molars, premolars, and any big bulky diamond. KS stands for Coys and Spear. It's really a bridge diamond. I'm telling you, any big rounded diamond, what is that for? To round off edges. That's all. The Fisher burr is actually your workhorse. People ask, how far do you sink it in? You sink it as far as you can sink it. It's going to feel weird to you when you haven't done that. Now today, all of you are familiar with luxators. But luxators aren't even the last, that's not even the latest. You need to have luxators. I'm going to tell you right now. They don't cost a lot of money. Get one set. I have 4 of them in my office. So when I go to do surgical extractions, believe it or not, I have the original elevators I just showed you that are lame, that have been around for 100 years, the 301, the 302, whatever they're called. I have a package of luxators. And then the latest thing that I've had for a year and a half, they're the luxators. See those little angles? That's why they're so special. And it's powerful. It's not about forceps. It's about elevators. This is the Salvin kit that is amazing. Let's see. So you need the Salvin PDL elevator kit. I don't get paid anything to tell you that. If you're going to take teeth, that's the 3 things I have. And sometimes I'll go a week or 2 and never even reach for this particular kit. You can't see it because the photography in this room, the screen, not the screen, but the cameras aren't that great. But they all have these special little angles. See, that I took close-ups. Like, that's an angle, I don't even know what it's for. Sometimes I'll just grab for something and, it works. I don't know. But they're way smaller than luxators. See, they're all different. Like that one has a little arrow on it. They're just amazing. And you're going to use and become familiar with the ones that work for you. That's what's going to happen. But you need this. Quick lesson, I'm going to divert to socket preservation. That is the standard of care whether you're doing implants or not. So how do you know, and you should charge for socket preservation, how do you know what to put in the socket? I'm going to tell you, everything I tell you is from the top and the best guys in the profession. So you carefully debride and you mix Menros, that's from BioHorizons. You mix demineralized bone fibers. Also, I don't care where you get those at. So mineralized, demineralized, and something that has calcium in it, which is usually cow bone. Why do you do that? Because the research and the studies are abundant that your sockets look a lot different 12 weeks later. So, you show me 5 minutes? I can't see your hand. I thought you were telling me 5 minutes. What time? I have no idea what time it is. 2:58. 2:58. What time am I supposed to go to? 3:15. Oh, shit. All right, let's go. Sorry. Sorry for my language. Okay. And so this is what it looks like when you're done. Right there. That's a perfect socket graft. And here's what it looks like. And sometimes I'll put collar plug so it doesn't fall out. And here's the outcome. 4 weeks, 12 weeks. Even if you're just doing crown and bridge, it's a beautiful way to proceed.
Sir?
Yeah. Well, that papilla isn't just a graft. What do you think it is? That's contoured by my provisional. My provisional crown, which is 3 millimeters into the socket. Day of surgery. Everybody familiar with physics forceps, right? They're called golden forceps. I've taught for them. I've gone to Michigan. It's a good product. If you go and you listen to them, they'll tell you that's all you need, and it is not true. That's why I don't work for them anymore. They fired me, because they did, because I told the truth. It's ridiculous. You can't do everything with this. It is cool, but you need more than cool. So you can do you can do surgery with or without this. It is nice to have. You got to be patient, because it's not about pulling, it's about a little pressure on the wrist. And if you go too fast, you break the buccal plate, which is no when you're doing implants. But it's an elevator, that's all it is. It's another elevator. It's a good product. It's just you need more. This is their slides, not mine. Since I only have 15 minutes, so this is the basic thing I want to say to you. No matter what tooth you're taking out, the very first thing I do, think about why I do what I'm about to tell you, is I open up the interproximals, because I'm going to trough down the root. If I don't open up the interproximals, how can I trough down the root? So the very first thing I'm going to do is take a big fat diamond and open it up, like you see there. Okay, I'm going in to pull that tooth. That's the first thing I do. Second thing I do is I go down. Now it looks like that. You don't have to even go through all that. Now I got plenty of room to go left or right. And if it's a molar, yes, I'm going to hemisect it or trisect it as far as the burr will let me go. You're not going to hit any structures. I'm telling you, you're not. Don't be scared to think because what's going to happen if you don't do that is you're going to stick your elevator in and you're still going to break the root. Do I flap or not flap? Always go in without flapping until you have to. That's my answer. Because the morbidity of healing is way better if you don't flap. But if you can't see, flap. So you need to know a little bit about flapping. I don't know if I have that here. Yeah, there you go. I'm on my game. I'm skipping this. It's a video. We don't have time. There's about 3 kinds of flaps. Envelope. That just means you're not making any distal releasing incisions. A distal releasing incision flap, because you need to see more, or 2 distal release incisions. Save it for a rainy day. We can talk about it. I'm going to some practice management. But it's cool being able to be a surgeon. Let me tell you something. It's not a conflict for you to do implants, oral surgery, and have every specialist in the area hate you. If you don't end up sending them to rescue you all the time, which I almost never do. I never do, not almost. They'll respect you. For me to get that permit to teach you in my office, there were oral surgeons on that board of dentistry. You can believe they wanted to tell me no. But they really couldn't. I didn't give them a good reason to tell me no. I've never had an incident in oral surgery. Never had to refer to it. And I am not even talented. I'm not even smart. I'm just, I just trained a lot. But it's cool taking out cysts and, things that you'll get to do. If nothing else, it really brings variety to your schedule. Okay, so we're going to blitz you now with a couple of other things. Anything you want on oral surgery, just ask me. I sent you. You guys have a handout. And if you don't have it, ask me, I'll send it to you. Okay, so let's do this real quick. I told you I would do this. I also told you this morning I would give you a lot of free things. So I'm about to give you, when I say give you, you have to ask me to send it. And for the 10th time, if you just say send me the stuff, I won't remember what you're asking for, and you'll get about 4 emails from me. It's things that cost me money, things that cost me a lot of time. So my intentions, my agenda for you is good. Okay, so in your office, if you want to soar and be successful, you got to know the difference between lip service and meaningful service. Lip service is, how are you doing today? when you could give a crap to Mrs. Jones, or just thank yous that are mindless and empty. Every day, do one thing for a patient. It has nothing to do with anything in relationship building. Trust me, if you really do it, it's like doing 10 push-ups a day to start with if you haven't worked out in a while. A week turns into 2 weeks, and 2 weeks turns into a month, and you start to notice changes. Well, same thing. So you get somebody in your office, maybe your new patient coordinator, maybe your office manager, that urges you, the doctor, not the assistant. They can do it too, but you need to do it. A phone call to one of your aged patients. You're going to feel so good when you do this. A card for somebody. Flowers is a little bit up above and beyond, but a phone call, a card, every single day. A picture, a photo with somebody. You know, that's me with, we take care of a, what do you call it where the nuns live? Convent? Is that what it's called? Well, we take care of the whole convent. You bet every time they're in there, take a picture with them, put on Facebook, because who doesn't like that? It's like a president kissing a baby most of the time. So, and plus it's nice. Take pictures generally with, this is a little girl waiting for her father. That's her father's in a chair. And, you know, I got time like that because I got a sedation practice. Think how you can build a social community feel within your business. So, this is something we did. I don't recommend you do this if you're having trouble making payroll. Something we did within the last 6 months. Thank you
call
night
this
for our patients.
Patient Appreciation Night. I got great food coming. You already got the drinks. So this is a couple hours of your life that we want to break bread with you. That's what this is.
I attend the Shiloh Baptist Church. I'm a youth advisor, and Dr. Rasner donated us a large amount of money, and we just want to thank him.
Put this on Facebook. Nothing else. It makes you feel good, to be honest with you. Don't do anything but
Hi,
that.
Dr. Rasner. Thank you for having us. It was a lovely event. Thank you.
Food was great, yeah. Excellent.
Everyone here is having a wonderful time.
Very
Thank
nice.
you for
Thank
your
you for
kindness.
having us.
Yes.
Thank you.
And keep up the good work.
Yes.
Everyone's got pearly whites and they're sparkling. It's the Rasner smile.
Thanks, Doctor.
smile.
So that's a little different than just saying I love my patients. I don't know what it cost me. Maybe it cost me $2,000. I mean, don't do it if you're struggling. I'm just saying, this is the stuff that we do. I am by far the highest fee-for-service guy in Cumberland County, New Jersey, which includes 30 other dentists, if not 40. I'm by far. I mean, I would bet you have a hard time finding a crown over $900, and my crown's $1,600. So how did I do that for 36 years? And do not tell me you can't do this. I know you each come from a different place. I know some of you are struggling with insurance. And I'm not telling you not to take insurance. I take some insurances. You know, I have associates that do some of them. You know, I personally might take one or two. The first thing I would implore you to do is at your next meeting or have a meeting to break down what are you getting from the 5 plans you're taking now. Do you really know? Because most of you don't. I didn't know. Do you know what? Maybe you're getting $700 for a crown from this one, but $400 from another. At least figure out where you're starting from. This is on Facebook. Asked me to send you my Facebook method for getting likes. I told you I went from 300 to 23,000 likes in a year and a half, not paid, organic likes, real likes, and I did it. I'll show you how I did it. One way is I get somebody to constantly post for me. Now, remember I tell you the truth. Remember this morning when I told you how to get recall? I said, pay your staff. I know that's not sexy to say to you, but it's what's worked for me the best. That's why I told you to do it. And it's worth it to pay 10 or 15 bucks, whatever it came out to. I don't remember. Well, I tried everything to get my staff to blog for me or whatever this is called. And they don't do it. So I'm paying somebody $300 a month. That's the truth. And now I don't worry about it. It's constantly hit up. It's by the way, it's a patient. It's constantly hit up. I see this stuff, care you can smile about. I have no idea what's going to be up there. This I just found at the break. I didn't even know this was on my Facebook. So this is a picture. By the way, ask me to send you because I just got this. I paid for it. I'm giving it to you for free. So you get these signs from me. Take them to your printer. It'll say no cavities. And you get like 5 signs from me. You're not going to get the signs. You got to take it to your printer and get the signs printed. Why am I smiling? No cavities. I love my dad. Whatever. I don't even remember what they say. But I just paid for these. I'll give them to you. And this one says, I'm smiling in this photo for 2 reasons. I was in Italy the day before my trip. I lost a crown on my front tooth, and Dr. Lipsky's my associate. That lady is putting this up. I didn't even see this until the break. Okay, so another way is, when they like you on Facebook, when they come in your office, have a basket behind your front desk of mouth spray or whatever, hand soap. It doesn't matter what it is. Ask them to like you. This is the truth. This is how I got. Now, here's how I got a lot of them. That's the things we have in the basket. I have contests. Take a picture of your smile and tell us why you're smiling. Okay, that's what this contest is. I just started a new contest last week. I did it with the Philadelphia Eagles down here, and the winner of the contest gets 2 tickets to the Titans. I did this one. So this is what you get. This dude's sending. You get this stuff, and this is on your Facebook page, and this is establishing a relationship with your community, and it's fun. I mean, it's really. Look, you guys get it. You're out on a course on a Friday afternoon. You're still in my course. It's 3, whatever it is. I know you get it, but it's easy to forget to have fun. And when you're successful, it's a little easier to remember. I mean, that's cool, right? Somebody sent that in. This is what I have up there right now, just this week. Win 2 tickets to see the Sixers play Phoenix Suns November 13th. All about smile. You want me to send it to you? I'll send it all to you. Just tell me. It's going to take a lot of emails. I'm skipping all the surgery. I just want to show you one more thing, and we'll let you go. I told Chris I always want to do practice management. I said, you guys aren't going to want to know this. Sorry about this.
I had for 30.
So let me ask you what you want, because we don't have time for both. This is case presentation or marketing. Which one you want? Hands of that one is 10 minutes of whatever it is. Who wants marketing? Nobody. 1. Well, you ain't getting it. 2. I got 2. I like doing marketing more, to be honest with you, but it's okay. Huh? All right, I'll try. Maybe I'll do both, 5 minutes on each. This one's about. So, do you ever walk into a room? I mean, I do, and you look at the patient for the first time ever, and you're thinking to yourself, "What are you really thinking about?" I wish I could get in your mind. What are you thinking about? Well, I wondered that so much that I did this.
That I've had for 30 years.
You got volume back there?
What are patients thinking?
I love the dentist.
How about you?
I'm terrified.
You're terrified?
Mm-hmm.
Dentist.
Yeah, when I say the word dentist, you think about what?
Getting my teeth pulled, getting my teeth clean.
Get them clean?
Surgeries and cavities and nitrous.
Drilling, picking.
This is in Cheddar City, Philadelphia.
Falling out of my mouth, followed by torrents of blood.
I stopped hemorrhaging after about an hour. It was terrific.
You want to take a look at the teeth, so you know I need you right now and then, okay? I got to get 3, 16, 20, 21 now, 30, 31, so you should know.
Do you trust your dentist?
No. She makes me feel very bad about myself.
How do you rate the dentist 1 to 10 that you've been to in your life, like on trust? Like 10, you trust them forever. 1,
Out of
not
5.
So, out of 5?
Yeah, I trust them.
So you give them like a 10, right?
Yeah, 10. 20.
Okay.
Every time you go, they give you a new toothbrush So now at home I have 10 that I haven't used once.
I have to tell you, I tremendous admiration for the profession, but I'm absolutely thrilled that I no longer have a need for dentists.
He's consistent. He doesn't always try to ram different products down you, try to sell you teeth whitening every single time.
The thing I like the most about my dentist is the nurse. She's very beautiful. You know, particularly when she leans a little bit forward.
I love dentists. I love teeth.
I've bitten a dentist before.
You bit him?
On accident.
Okay. Sure it was an accident?
I warned him.
It's all about how they treat you when you go in there. I mean, if everybody's nice to you from the moment you go in, that's the kind of thing that has kept me with dentists for a long time.
I know a friend that went to the dentist, and something went wrong. She put the Novocaine in, and she lost her eyesight.
Lost her eyesight?
Completely.
Just tell me what you're thinking about your dentist.
Okay. Comprehensive exams have dropped 70% since 2010. You're not going to be productive doing one tooth dentistry. I'm going through this quick, obviously. One of the reasons I get such high case acceptance, this is a cornerstone of success, is, and you need the verbiage for this, so write it down, send me the verbiage for this. How do you get the husband or wife to come to the first visit? Is because I have both the husband and wife coming to the first visit 80% of the time. Listen, you live in 2016. Having treatment plans 20,000 north is not unusual. Who in their right mind is going to go to a dentist, come home, think, am I living on Mars when I say this to you? Who's going to come home from work and say, oh my God, honey, I met the greatest dentist today, Steve Rasner, you're going to love him. God, I mean, he's got like animal crackers in his waiting room, and people talk to you there, and, oh, that's all good. What do you say about your mouth? Well, I am so confident in him. How much is it going to cost? $18,000. I'm dead. I'm toast. I don't care if it was 100% ethical and honest. I'm not going to get it. So you're not going to get 100%, but if you don't even try this, you're going to get 0%. So I have them there under my auspices 80% of the time. And I will tell you, they are right there in the dental assistant chair after x-rays, and I am working both of them. I want them to hear me. Now, I'm going to skip that one. You heard me say, plan for the worst scenario. If you're not sure, then count it. You're better off giving the money back than tell them they owe you more five visits later. They will think about it. Think about how powerful it is to go to a patient 3 to 4 visits in and give them money back. Pretty big. I told you, think about your first contact. Don't look like him. Brush your teeth, comb your hair. I'm not going to tell you, just tell me to send it and I'll send it. You have my contact, right? It's Dr. Rasner at AOL. It's pretty, 3 minutes, right? 2 minutes. Okay, well, you're not getting marketing. All right. It's all about the first appointment. It starts with the new patient coordinator. We screen people over the phone. You may think I wouldn't screen people because it's day and age, I don't get as many new patients, but I do not want the patient to come into my office and say to me, I just want this one tooth pulled. So I eliminate that by having her ask some questions. And then most importantly, she is going to say this. Let me tell you how the first visit is going to work. Dr. Rasner is going to take a look at all your teeth. They did not ask me to look at all their teeth. They asked to come in because they lost a filling. She's telling them, I'm going to look at all your teeth. Why? Because we're going to get rid of those people that might say, well, I don't want all of that. I don't get that much anymore. But if that's, and then she's going to respond. Listen, I've been with Dr. Rasner a very long time. One thing I'm positive of is that you will save money and time if he looks at your whole mouth, okay? He's only going to recommend what you need, and that's the truth. She can say that with authority because it is the truth. If they don't accept that, then I'm not bringing somebody in to pull a tooth. Do not buy the philosophy that you bond with them and they're going to come back. You got 8 hours a day to do one thing, the same thing I got. To produce dentistry, meet new patients, treatment plan them, recommend for them, and don't waste it on an hour patient that sits in your chair and the hygienist comes into your office and says, Huey, Dr. Huey, they're not going to let me take an x-ray. That's why these protocols exist, because that's happened to me. She's going to say that Dr. Rasner is going to take whatever x-rays he feels are necessary. And you're going to get some people to say, oh, we don't want all that. No, they're not going to say that. They're going to say, I just had all those x-rays taken just last spring. And that means they had bite wings in 1998, okay? Do not let the x-rays be the reason you don't proceed. Give the x-rays away. I wouldn't advertise it, but say, just do it. Why? Because we do elective stuff. You have the customer, whether you like it, or the patient, whatever you want to call them. They're in your chair. You're going to send them back to get their x-rays? Steal the patient from the doctor. Every patient you have, you stole from somebody. Unless you got them when you were 2. I could open up 5 practices with the patients that have left me over 36 years. When they come into your office, try this. This is a 120-day rule. Do a one-to-one interview. That means in a private room, re-ask the questions that you asked on the phone. Why? Because people lie over the phone. That's why. And you're going to get new answers, and they have a spouse right next to them. Take their x-rays. You get coached before you go in. I get coached. I'm told she's a divorcee. She doesn't feel good about herself. She's broke. Whatever it is, I need to know. You get a one-to-one. You get coached by your new patient coordinator. I start with my philosophy of care. I'm going to stop with this after I tell you it. This is very important. I'm telling you. Remember the Jerry Maguire movie? You had me at hello? I had him at this. Because this is what I say, and I'll send it to you. You don't have to write it down. I tell him, I said, I want to tell you, listen to me real quick, and I'll stop on this, Jenny. I want to tell you where you're sitting today. Because I'm going to tell you right now that this office is different than most offices you'll ever go to. And I'm going to tell you why, and it's good for you. Here's why. Number one, I'm a private office. I'm not corporately owned. I can take and send your crown wherever I want to send it. Now, you know who that's going to be to? It's going to be to the best lab I can find in the country, because that's where you're at. Nobody's going to make me send your crown to Mexico or China so I can save $50. And I talk with an attitude, and people get it. I said, secondly, I spent a lifetime of education with the best minds in dentistry. And I've learned a lot of stuff. You want to be put to sleep? I'm your man. You want me to take a tooth out or put a tooth in? I'm your guy. But you know what I learned the most? I learned this concept called what to do when, meaning, what's the right recommendation for you today, Sylvia? How do you know I'm not being overzealous? How do you know I'm not being neglectful? Well, I've spent a majority of my life learning it, and this is what I do. I look at 5 things on you, no matter why you came in here. I don't care if you don't like your smile, you chipped a tooth, you got a pain. I'm looking at 5 things on you. And I tell them the 5. Their gums and why. Every tooth and why. Their missing teeth, their bite, and their aesthetics. And there's a whole wrap that goes with each one. But basically, I'm telling them I'm doing a comprehensive exam. That's why I'm so successful with so much work to do, because you can't say, I'm going to do a comprehensive exam on you right now, because people don't want to hear that. You guys get it? One more thing. Do my x-rays. If you know the treatment plan day 1, and you often do, give it day 1. Things to remember. Forget that. Keep ambassadors of goodwill. Not everybody accepts my treatment. This guy comes to me for 30 years with that headlight crown. That's a headlight crown. Comes into the room 5 minutes before he gets there. Told him for years, hey, you gonna let me do your smile over, Arnie? Come on, man. Guy was a bachelor, finally got engaged. The first week he's engaged, he comes back because his fiance doesn't like it. He's an ambassador of goodwill. Now he looks like that. Don't dissuade him if the right treatment plan isn't right. As Carl Misch said, I'd rather see the back of their head one time than the front of their head for the next year with adjustment problems. Think it out. Do the right thing. Come on, man. Are you crazy with that root canal? That doesn't even have a mesial distal. It's got an inferior-superior border. Think it out. Do the right thing. Thank you very much. I'll be out there. Thanks. Bye-bye. Thank you.